Hello, my name is Harini.
Hi, my name is Brithi.
We are from Mount Hebron High School, and our starting time is 12:34 p.m.
Okay. I know our names.
Yeah. Okay. Date, April 3rd, 2025. Time 13:30, which is 1:30 p.m. Location, Florida. Investigator Irene Johnson, Orange County. Okay, at approximately 1300, which is 1 o'clock. At approximately 1 o'clock on April 3rd, 2021, the Orange County Sheriff's Police Department was dispatched to the Orange County Waste Management. I think this is supposed to be 2025. Right? Why is it 2021?
Wait, is this like... Maybe this report was written in the 2025?
This says date 2025. Okay, whatever. Was dispatched to the Orange County Waste Management Station. They were responding to a report of a possible body found inside the bed of one of its trucks, discovering upon emptying.
Wait.
Deputy Michaels relayed the following. Yeah.
Like, what kind of truck?
Garbage truck, I think, because it's a waste management station.
Oh.
Truck 52 was on its normal route in southeast Orlando. Its route included tending to a commercial dumpsters at a local business, driven by John Sebastian Michael Redbook truck, keeping his route at 5 a.m., right?
Yeah,
5 a.m. Finished at
12:30
p.m.
Yeah.
That is 7 hours. During the route, neither driver noticed anything unusual.
Okay.
Upon arriving back at the waste management station approximately 12:45 p.m., they began the process of emptying and cleaning the truck. While they were unloading the contents of their truck, they noticed something unusual. When they were able to get closer, they observed that what they thought was a human body.
Oh.
They immediately notified their supervisor, confirmed what it was a human body. Oh, why does it keep turning off? 911 dispatched. Is it recording? Sorry.
It's recording.
Okay. Deputy Michaels arrived at the scene at 13:05.
105.
Which is
105. Yeah. Okay, wait. So they found her at 12:45. So she was just like in the truck during their shift, and they probably like before didn't have anything in their truck. So she was. Wait, can I do notes like on the back of this? Am I allowed to do notes?
Yeah, we're only submitting this one. We can do notes. We just flip it over.
Okay. So, she was found. Well, no, she was in there to deposited. Oh my goodness, deposited between 5.
Well, she also could have been deposited before they took the truck out, but don't they check the truck before they take it out?
Yeah, that's what I was
in the
thinking.
mornings.
Okay.
So it has to be.
Basically,
it was in someone's trash can and they just threw it in, or someone while it was moved. How can they do it? Or while it was standing there, like say at a house, it's standing there and like they're like getting trash, but in the back, like someone else comes and puts the body inside. But they couldn't have done it for too long. Like, it's not like they had a lot of time. It should have been, like, really quick. So I don't think there would have been any injuries from throwing the girl in the truck, right? Okay, let's move on.
This is while they were unloading the contents of the truck, they noticed. Okay, yeah. So they didn't notice before. Yeah.
Okay, 911 dispatch relayed the information to the Orange County Sheriff's Office, and Deputy Michaels arrived. Oh, I already read that. Paramedics pronounced the individual dead on the scene and confirmed by negative EKG tracings. Okay. Called in at 13:15, which is 1:15. Arrived on the scene at 1:30. She's 30 to 40-ish, white female, fully clothed, cold to the touch.
Wait, was she examined at 1:30?
No.
Because it says they're called to the scene at... The investigator arrived at 12:30, so around 12:30 to 1 o'clock is when... Because Irene Johnson, who's the investigator, it also says it up here. This is, like... I'm guessing she's the main person.
She's the examiner.
Yeah, so... I'm guessing around, like, 12:30 to 1 o'clock is when she was examined. Okay, whenever then.
Oh, well, 1:30 is when she arrived. Do they examine the body on the site? Is that what we count, or the autopsy is what we count? For, like...
Oh, maybe autopsy is later.
Autopsy is what shows what's actually on the body. Like, the outside is just what you can see to the naked eye.
Yeah, but they could have done the autopsy on the scene. Okay, well, we can say examination began around 12:30 to 1.
So, 30-40-ish cold to the touch, superficial abrasions and contusions were observed over the decedent's face and arms. So, like, abuse.
Wait, where are you looking?
Abrasions, contusions. So she had bruises all over her body, or all over her face and arms.
It could be. That also could be from just like falling in the truck.
But it's garbage.
Not all garbage is soft though. Like sometimes in bags there'd be like glass and stuff.
True. But I don't know if she'd get that many bruises. Well, I guess it doesn't tell us.
She's like bouncing around while the truck is moving.
And for a temperature reading of the forehead was 88.
Okay.
Full rigor had set in, so 8 to 12 hours.
Yeah.
An Orlando Community Hospital identification bracelet was present around the left wrist with the name Rebecca Stevenson and admission date of 4/1/2021. So
she was alive on the 1st. Because she was admitted on the 1st. We don't know when she left, but...
True.
Upon regaining consciousness. Upon regaining consciousness. She was unconscious when she got to the hospital.
And then she gained consciousness and then she just left. Oh,
yeah.
She had overdose of drugs.
Okay, so she had a drug overdose.
So potential, like, we don't have to decide now, but like one thing we got so far could be like drug abuse, not drug abuse.
Something
like
with drugs.
Over drug.
So just like this was like
like
they're looking
excessive
on
drug
the
intake,
3rd. They're examining her on the
test.
3rd. And so she was alive on the 1st, but yeah, so we know she was alive at least for a good amount of time on the 1st.
Mm-hmm.
But she had a drug overdose either on the... Wait, what's before April?
March.
Yeah, sorry, March 31st.
Something like that.
Yeah, March 31st or April 1st, she had a drug overdose. But she was alive on...
She's Caucasian, and the date of the report was April 4th.
April 4th?
That's like when they did the thing.
Yeah, but it says April.
She died on April
here.
3rd. Oh, you're right.
So is it April 4th?
They did her autopsy the day after.
Oh, okay, that's fine.
So
yeah, autopsy report on the 4th. Okay.
So autopsy is what we look at for like say we said 8 to 12 hours for rigor mortis to set in, but they said rigor mortis set in when they like went to see her body like at the site. So I think that's the time we count, which is 1:30.
Okay.
So it has to be 8 to 12 hours before that, because autopsy, they didn't say the rigor mortis after they said the autopsy stuff. Okay, so generally the body's well developed, well nourished, 63-inch. Well, okay, whatever.
Where were you looking?
Clothing very right.
Oh, I see.
At the time of examination, Deccan is dressed. I don't care what she's dressed in. Yellow metal hoop, earrings in each ear, clear stone. Okay, so she was in the hospital.
Yeah.
A baggie of unknown white substance, probably drugs. So she was a drug user.
We already know that she was a drug user because she had an overdose. We don't know if it was like her or someone else who gave it to her though.
Right.
But we know that she has taken in drugs before.
Yes. Okay. Okay. Scalp is covered by hair. Irides are blue and cloudy. Sclera are white. That means like she's like her eyes were fine, right?
Yeah.
Okay. Bilateral bulbar and palpebral conjunctivae have diffuse potential. The external nose has no trauma. Nasal septum is intact. Each robe is pierced. Okay, teeth may be in poor condition because of her drug use.
Could be drug use, or it could just be like poor dental hygiene. Yeah.
Frenula intact, and then she has a tattoo.
Okay.
What does bilateral bulbar and palpebral conjunctivae diffuse potential? I feel like that. That might be. I think that has to do with strangulation.
Where are you looking?
This one. Bilateral bulbar palpebral conjunctivae has diffuse potential. I think that means strangulation.
Okay.
Torso has no congenital deformities or scars. A tattoo. The superimpose was pierced once.
Which is just belly piercing.
Okay. Extremities have no congenital deformities. She has tattoos. Up to 3 linear scars on the ventral surfaces of both arms. So she was cut by something. Or, yeah.
But
a recent needle puncture site on the left antecubital fossa. That's probably from her admission to the hospital where they
are the scars like... Because if the scar is already like developed, it's like done. Because it's not saying that it's like a fresh cut or anything. And that could just be an older thing. It doesn't have to be with...
Sure.
Up to 3. Oh.
It's just
like linear scars could be like
scars.
No, linear scars could be like cutting, like self-harm cutting.
Okay. Recent needle puncture site. That needle could be either like a drug needle, or it could be
It could be for using.
Or it could be like her admission to the hospital, like
yeah.
what they gave her. Okay. Fingernails of both hands are covered in black nail polish, covered in blue polish. Electrocardiogram pads are on the
right upper chest, left upper chest, right abdomen. That's fine.
Okay. Both cheeks have multifocal red tan abrasions or bruises. Both eyes have diffuse pulpar and palpebral conjunctiva. Okay. Right temporal scalp has a 5 cm lineal diagonal laceration.
Cut.
So cut in her head.
Yeah.
Like a cut where you see her bone.
This one doesn't say that you see her bone.
Wait, what is laceration again?
Like a cut.
Okay, what was the difference between laceration and like any like scar?
Scar, I think, is like when it's like the blood has clotted, and you know how like you can see the scar when it's healing, like that, like
laceration's like an open, fresh cut type thing. Oh, okay, so her head damage like happened very recently.
I think so.
Right neck has a 4 to 5 cm
purple contusion. Oh, there's a bruise there. Why is there a bruise?
So there's like bruises near her like head, face area, and in her
and also
arms
her neck,
area.
It has like right neck and left
less
neck.
of her like bottom of the body, more of like her top of the body. Left neck has a 7 cm purple linear contusion. Scalp has multifocal underlying subhelial hemorrhage. Ramus of the right mandible is fractured.
There's more
ramus of
head
the
damage.
left. So basically, her whole head is fractured. Mucosa of the bilateral mandible is lacerated. 15 milliliters of subdural hemorrhage around the cerebral convexities. Both cerebral hemispheres have multifocal subarachnoid hemorrhage and cortical contusions. Base of the skull has a hinge fracture involving the petrous portions of both temporal bones. A layer-by-layer dissection of the anterior and posterior musculature of the neck reveals no hemorrhage. So she didn't have any neck injuries, but she had a lot of head injuries. She had neck injuries
because there was contusions, but there was just no internal bleeding.
There was no bleed. Oh, okay.
Yeah.
Hemorrhage is internal bleeding, right?
Yeah.
So she did have a lot of internal bleeding.
In other places, but not on her neck.
Yes.
Her neck just had like bruises. Okay. Superior chest condition has
We're 12 minutes in.
Okay. The abdomen has diffuse abrasions. She has abrasions on her abdomen. Okay. There's a purple contusion on the right abdomen. It seems like it's not just like upper body, it's like lower body too. It has there's like different bruises all over the place.
Yeah. So it could be like a head.
It could just be like because it's not only in the head. So maybe the main cause of death was from the head, but there was also like other random bruises here and there.
Okay, superior chest is congested and has diffuse petechiae. The abdomen has diffuse abrasions. The right abdomen has purple contusion. Sternum is fractured at the level of the third rib insertions. Posterior lateral aspects are fractured, associated muscular and soft tissue hemorrhage. The left pleural cavity contains approximately 450 milliliters of blood. Right thigh, purple contusion. Left calf abraded.
Oh, see, that's what I'm saying. There's injuries all over her body.
Yeah.
Which I think could be from being dumped in the truck. Abuse or being dumped in the truck, because these are recent.
Yeah.
I'm guessing. If you can still see them,
there's
very
also,
well, they're not like healed.
Let's see. Rib damage. Like broken ribs.
But like, so broken rib damage is normally with like... Is it like broken ribs or is it just...
I don't know.
It's a fracture. So it could be like from like blunt force.
Yeah, but I don't think it's from before. I think it's from like something recent. That happened.
Yeah, because she would have... Oh, because if it was there before, they would have noted it at the hospital.
Yeah, since she was very recently at the hospital, all those like new things they're finding is...
It would have been noted in the hospital examination, but all we saw was that she was admitted for drug usage. Or not drug use, sorry, because she was unconscious from drug overdose. The anterior left ankle has a 12 cm laceration with exposure to the underlying bone. Oh, okay. Yeah, so you can see her bone.
Okay. Right pleural cavity, pericardial sac, peritoneal cavity have no excess fluids or adhesions. The left pleural cavity has no adhesions. Okay. heart is, we should kind of speed up because I think we're like 15, 20,
Oh,
20.
actually.
We are 15 minutes in.
Oh, you have to hurry up.
Okay, we have 25 minutes left. Heart is 340 grams, normal distribution of cardiac fat, proximal left anterior, descending coronary, or, oh my gosh, what? Atherosclerosis, up to 50%. Myocardium is dark red, firm, has no scars. Left ventricle is, okay. Right ventricle, it should say measurements. Okay. All these valves are thin, pliable, and have no vegetations. Aortic valve has nodular calcifications. The aorta has calcified atherosclerotic plaques along its length. Proximal bilateral iliac arteries have atherosclerotic plaques. Okay.
The right lung's 80 grams slope along the 750 grams surfaces of both lungs are dark red, smooth, and have antarctic pigment. The parenchyma is dark red, firm, diffuse congested lungs and trachea are patent and lined by 10 intact mucosa. Pulmonary vessels are patent. The liver is 150 grams and has a pale yellow nodular intact capsule. Parenchyma is pale yellow, firm, and nodular. Gallbladder contains approximately 5 milliliters of dark viscous bile and 4 smooth multifaceted yellow collets. The spleen is 150 grams, purple, fine, wrinkled, and intact capsule. Parenchyma is dark red and soft. Cervical, mediastinal, and abdominal lymph nodes are not enlarged. Oh, that's good. No enlarged lymph nodes.
Tongue has no bite marks, so no seizure. Esophagus is lined by tan intact mucosa. Serosa, the stomach is tan gray and glistening. Stomach contains approximately tan fluid and partially digested food of what appears to be French fries.
Okay.
Gastric mucosa is tan, has unremarkable. Just as a note, I'm touching my computer because it keeps turning off. I'm sorry. Gastric mucosa is tan, has unremarkable rugal folds intact. The external surfaces of the intestines are tan gray, have no palpable masses. The appendix is tan gray and smooth. Okay. Right kidney, left kidney capsules are adhered to dark red granular cortical surfaces. Parenchyma is dark and red as well. Cortical ureters have a normal coarse caliber. Urinary bladder contains approximately clear yellow urine and intact mucosa. Fallopian tubes and ovaries are unremarkable. Uterus is 700 grams enlarged and foggy. The uterus contains. Oh, she was pregnant.
Oh, okay.
Contains male fetus. Weight and measures of the fetus place his gestation age as approximately 23 to 24 weeks. Is that second semester?
23 to 34?
No, 23 to 24. Is it like 30?
How many
38,
weeks
39?
is 9 months? How many
36.
is 3 months?
3 months is 12 weeks.
Yeah. So second
she's
trimester?
She's like, it's not semester, it's
Yeah,
trimester.
trimester.
I don't know what I'm saying. Placenta is unremarkable. Endometrium is thick and dark red and intact. Okay. Adrenal glands have well-demarcated golden yellow cortex of brown gray medullae. The pancreas is tan, firm, lobular. Thyroid glands is dark red, firm, and not enlarged. A layer-by-layer dissection of the anterior-posterior neck reveals no hemorrhage. Hyoid, loin, and thyroid cartilage are intact. So she has a lot of head injuries. And then epidural hemorrhage is absent. Leptomeninges are thin, transparent, have no exudate. Vessels at the base of the brain are normally formed and are patent. The uninjured portions of the cerebral hemispheres are symmetric. The gyri and sulci are otherwise unremarkable. Coronal sections of the cerebrum, transverse sections of cerebellum, and brainstem reveal no hemorrhage. So if the cerebellum and cerebrum, like that's the part connecting down to the neck, right? So I think her brain injury was more like towards the top of her head. Okay. So could be from blunt, like head trauma.
Wait.
Blunt force, maybe. Okay, so like right now what I think is it could be blunt force, strangulation, physical abuse, drug intake, maybe. We never read toxicology.
There could be self-harm involved because of the scarring.
Okay, but that's not her
Scar?
cause of death.
Yeah, but actually, yeah.
I definitely, this is not a suicide, and I don't think it's undetermined
suicide.
either. So we're left with accidental, homicide, or what's the other
Natural.
one? Yeah, this is not
It's
natural
not
either.
natural, no.
So it's either homicide or accidental. I'm thinking it's a homicide.
I don't think it was accidental if she was thrown in the garbage truck.
Yeah.
So let's say homicide then.
Yeah. Okay. Manner of death, homicidal, or homicide or homicidal.
Okay.
Uh.
Immediate cause of death.
That's what we still have to figure out. What about the time of death range? So
we're gonna say like, okay, well, we know that there was
8 to 12 hours if full rigor mortis set in, right?
Yeah.
So
was there anything about rigor mortis?
No.
Oh.
Okay. It just said rigor set in, so rigor mortis. But
where is it?
It was 5 to 12:30 a.m. when the garbage truck went out. The body has to be put in there between that time because they clean out the truck every day. And if there was no trash or anything in the truck when they went out, they would have noticed if they put something in.
And then you want to do the
I feel like if there was no unusual activity, it has to be related with like when they took someone's trash, it was kind of in there, just buried in like a bunch of stuff.
What's 98.6 minus 88?
For the temperature thing?
Yeah.
98.6 minus 88. Wait, 98 minus 88 is 10.6 divided by 1.5 is about 7. Okay, but like it's 8 to 12 hours, right? So it has to be 8 to 12 hours if full rigor is more 7. But think about it. If they did the body examination thing at 1:30, because they said 13:30, then it has to be like 5 is like the minimum it can be, and 5 is how many hours away from that? 7, 8 hours and 30 minutes. 5 o'clock is 8 hours and 30 minutes from 1:30.
I'm doing math.
Sorry, wait. Death day is April 3rd? Yeah. The death day has to be April 3rd because she came in on April 1st. Wait, going back. She was at the hospital on April 1st.
Oh,
she was admitted to the
hospital. Yeah.
She was admitted to the hospital on April 3rd. Sorry, April 1st. And then she left the hospital, we don't know when, but she left the hospital, and then again she was found dead on April 3rd, 2 days later. And then her autopsy was performed on April 4th. So that's normal for the autopsy to be performed a day later. But so her death date is April 3rd, I'm pretty sure.
Okay.
I'm thinking somewhere in the morning hours. And they probably didn't do it at like 10 a.m. because honestly, like everyone's outside and like everything's like. And I don't think they did it the second this truck started either, at like 5. So I feel like it's around like 5:30 because that means that's exactly 8 hours. So that means it makes sense for full rigor mortis to set in.
But this is saying around 6 to 7 hours. So this is after their.
But if it's 6 to 7 hours, how can it be rigor mortis? That's my thing.
I'm confused. It could be a little earlier. It's not like a set range.
True.
Like it's around that, but wait, where does it?
So I'm thinking like 5:36 a.m. type thing. Because think about it, at like 5:30, no one's awake, pretty much. So it's like easier for them to do that. It's also it could be dark. It's what Florida.
Right. Yeah, it should be.
Florida, it should be dark.
They wouldn't know.
Wait, in April at 5 a.m. it is dark.
Yeah, because of
in Florida EST time.
But same as us, EST timing.
Yeah.
And no.
So it should be dark. When does it get? It gets bright at about like 6:30, right? Yeah.
Actually, later than that now.
Like 7-ish,
yeah. So
okay, but like 6:32. Think about it. Like school people would be awake and stuff. I think 5:30 is the time they would.
What day were they doing this on?
April 3rd.
What day of the week?
They found the body on April 3rd at like 12-ish. I'm saying
Wait, when
the body was dropped earlier, like that morning. So still.
Yeah,
April
because
3rd.
it'd be too bright. They would notice. But
I think it's April 3rd at like 5:30.
Something in the early in the morning. So we can say like probably like 5:30 to like what? When is it? Like 7 o'clock.
We are 25 minutes in.
Oh, we have like 15 minutes left. Okay, 5:30 to 7 o'clock. It'll be dark. So this is around our time range. And then I want to see like when did they say they took the 88 degrees?
Oh god. 88 degrees was like their external investigation thing.
Yeah,
So when she arrived at 1:30.
1:30. Okay, so then like around 6 to 7 hours before 1:30. On April 3rd, right?
So 7 hours, let's say before 1:30 should be
what is that? 13. So
8 something.
13 minus 7. 6.
Oh, okay. 6 a.m. Okay.
This is what 13:30 they did it.
Yeah.
Yeah, so 13:30. We're gonna say 13:30 they did it. So 13:30 minus like around 7 hours because it's 20.12. It's close to 7. So then that's approximately 6:30, which falls into this range.
True, but then the rigor mortis thing is telling me that like it should be a little more. Maybe we could do 7.5 hours before, so like 6 a.m. or 5:30 a.m.
Rigor mortis was fully set in, right?
At 1:30. They saw the rigor mortis at the exact same time.
Was that not part of the autopsy report?
No.
Oh, was that just before?
Yes. So rigor mortis set in at the same time, which is around 1:30. Okay, wait,
Yeah.
but okay. She came at 1:30. She probably saw it around like 1:45. If you ask me.
Maybe something like around 1:32.
Okay. But like, yeah, I feel like it should be if we say 8 hours before that, that's about 5:30, 5:45, 6 a.m.
Yeah.
Or we can just choose one. It's okay.
Okay, because this
I don't know. Is that really accurate?
Isn't probably fully accurate.
Okay. So can we do between that? So if it's 7 hours and rigor mortis
is closer
8,
to 6 hours
Why?
instead of 7 because sorry. Oh no, never mind.
Closer to 8.
Yeah, closer to 8 hours. Yeah.
So if it's 8 hours, that's 5:30.
So it's a good medium between 6:30 and 5:30.
2 to 5:45.
Yeah.
Okay.
Around 5:45. Okay. So around
5:45, which is 0545. Let's write that.
Yeah.
Back. Say 04/03/2025. It does say 2021 in here.
They want a range of the time of death.
Oh, range. Okay, perfect.
Yeah. So do you want to do like 5:45 to 6:30, or like 5:45 to 6:15? Let's look at the 30-minute range. Because
let's give a 1 hour range. Let's say 5:30 to 6:30.
Okay.
That makes the most sense. So it's on April 3rd, 2025. I know here they put 2025, but then everywhere else they keep putting 2021.
I think that was an accident.
I think 2021 is an accident. I think it's 2025.
Well, this is also saying 2021. I think it was 2021.
Are you sure?
Yeah. It doesn't really matter either way. Actually, well, it does, but only one thing said 2025.
But that's the main thing says 2021.
But this also says 2021.
I think they just messed up. But
yeah, but the date. Let's focus on the month and the day.
The month is what matters.
Month and day are the same, so it's fine.
So, okay, let's just say 2025 because that's the first thing written on here. I think this is one like taken from another year, so that's why it just says 2021. But okay, right, 2025.
There's nowhere to write the date. They knew she
No,
died
I remember seeing in the
sample,
the guidelines.
Oh.
On the rubric, it said we need the date as well. So let's just say on 4/3/2025.
Okay.
That's it, right?
Yeah.
Okay, so now on immediate cause of death. So we're between strangulation, blunt force.
I don't think
head
it was strangulation. Like there was some neck trauma, but it wasn't like.
I feel like it is blunt force head trauma. What would immediately cause death?
Well, that
like
would
physical
cause,
abuse wouldn't. Okay, strangulation would immediately cause death.
Because it does take a little bit of time for a hemorrhage to set in, no? Because of like the bleeding, it takes some time. Not a lot of time, but a little bit. And then so if they found her later, that could have given enough time for the hemorrhage to have killed her. Because say she died at like 5:30 to 6 o'clock. They didn't find her until 12:45, was it? 12:30. No, 12:45 they found her, which is a while later, and you need to like act quickly with those types of injuries. So, I think it.
No, but we said her time of death range, meaning she died at that time. She didn't die on the truck. She died before she was put into the truck.
Yeah, so that it wouldn't have given anyone time to figure out. So the blunt head force trauma
could have even happened like at night.
Oh, true.
Like it could have happened at 12. Like
before she was dumped in the truck.
Yeah, so we're having a fight with her and say they were like thinking what to do with her, and then they decided to put her in a truck.
Yeah.
But like she died at like around that time.
Okay. And the only issue with strangulation, I don't see any like that much evidence towards it. Yeah. Like she didn't bite her tongue, but that's not really like.
Wait, did we even look at the toxicology report? We didn't look at this stuff.
Right? Oh. At the note.
Okay, none of these are in high amounts, right?
Yeah.
Fentanyl?
They don't
is
look very high,
34.
but that's in nanograms.
Okay. So, I don't think it's drug things. That's like the cause. Okay. Diagrams, right mandible, left mandible.
Oh, we know there's injuries to those. There's a broken rib.
Broken ribs.
So that could be from blunt force trauma. It's a different
Wait,
part.
ribs are where again?
Huh?
Where are
Like
your
here.
ribs again? Right. So, are we thinking it's blunt force to the whole body or like just the head?
See,
I feel like the
we
head
know
is
there's
what caused the death, and then for other condition contributing, we could say
like other
to also the ribs.
because that could have been like before she died. Why are you laughing? Oh, that baby looks scary.
Okay.
Okay.
Wait,
but,
so her fetus died inside her?
Probably. If they found her that far afterwards, there's a very, very slim chance that the fetus may kill.
Also, I think they did say the fetus died.
Okay. And then there was bruises all over her body, but that could be from before because those don't seem like they're life threatening.
Immediately kill
Yeah,
her.
they don't look life threatening.
All of the head injuries though, those are immediately like life threatening. So
yeah, but even the neck injuries, there was no like they didn't say anything about hemorrhage. They only said
we have 9 minutes. We should write.
Oh shoot. Okay. They only said that there was protrusions.
Okay. So to write immediate cause of death, blunt force head trauma.
Okay, let's start with the contributing immediate cause of death. Let's start with the base of skull fracture.
The ribs, right? The broken ribs.
So the immediate cause of death?
Yeah, like other blunt force in other parts of the body.
I thought this has to do with it, like.
Oh, okay.
But
so like within. Wait, what does this even mean? Conditions contributing to the immediate cause of death. So basically, what did we find that made us choose blunt force head trauma?
I guess so. There's a base of skull fracture.
Okay.
I remember seeing that.
Okay. Cerebral hemispheres have multifocal subdural hemorrhage around the cerebral convexicities. That should not. I feel like that should be here.
Because that was part of like
evidence to support the opinion. This is our opinion.
But what is this?
I don't know. Other conditions contributing to the immediate cause of death, like other no.
Is that like the rest of the body?
Yeah, there are other things that caused her death. So we could say like physical abuse, for example, like bruises, like everything together the body couldn't take. But this is the main cause of death.
Okay. How much time do we have?
So 8 minutes. We should write fast. Can I write real quick? I'm just gonna write.
So there's both sides of diffuse bulbar and polypal conjunctivite.
Cerebral hemispheres.
The right temporal scalp has 5 simul.
Yeah,
there is cuts on the scalp too. So I'm pretty sure it was some sort of head trauma.
Multifocal
subdural hemorrhage. There's a lot of head injuries compared to everything else.
Yeah. Arachnoid.
Right mandible and left mandible fracture.
Oh my god, I can't spell. Sorry.
Actually, no. Do the cerebral hemispheres hemorrhage and cortical contusions. Yeah.
That's the one I'm writing first.
Okay. And then
next one.
The hinge fracture.
Base.
The skull has a hinge fracture.
Hinge fracture.
I don't think you can join full sentences. I think it's okay if it's.
Yeah, this is fine.
No hemorrhage of the neck, which is why I don't think there's any strangulation.
Should we write stuff like why we think it's not suicide? Let's say homicidal because dumped in a waste
management truck. Yeah.
What else about the injuries? Wait, any other injuries? Go ahead. Like that, like support head?
Of the head.
Oh, the diffuse bulbar thingy, I think, right? Yeah.
That's from the eyes. Doesn't that have to do with the, what's it called? Whether or not there's visible...
Oh, right mandible and left mandible.
Yeah.
Framus of both right and...
Did you write the subdural hemorrhage or did you write... Yeah, did you write subdural hemorrhage or did you write subarachnoid hemorrhage?
I wrote subarachnoid.
Okay, also write subdural.
Or must have both are
There is, hold on.
fractured. Okay. Mucosa lacerated. Should we write that?
Where is the mucosa laceration? Okay, and then do you want to write that the reason that it's primarily the immediate cause of death was due to head trauma is because the rest of the body only has like, my hands are like really slow today.
5 minutes.
Okay, reason of immediate
Okay, wait, let me think of what to add to this.
death to reason of immediate cause of death to.
I feel like here we should write
Wait,
that.
how do you like word this? I'm trying to say like the reason that the head is the immediate cause of death is because the rest of the body only has basic contusions.
You could just write that. Reason of immediate death is blunt force head trauma because the other bruises, contusions, whatever found in the body aren't life-threatening. Write that.
Head trauma is because.
For the other conditions,
Wait, 1 second.
Yeah.
Is because what is it? Rest of body has minor bruising.
Yes, I never wrote scalp has diagonal laceration. Write that.
Okay. Diagonal lacerations.
Afterwards, write 4 minutes. Abrasions and contusions found throughout body.
Oh, I wrote that.
No, for other causes or other conditions, I guess. Say abrasions and contusions found throughout body, and then also that did we say there was one neck injury thing? There's no neck injury. That's okay.
Okay.
That's okay. The rib injury. We should write that as other conditions.
Oh, my pencil.
Oh no. Can we get another pencil?
Yeah, we're out of time. Hold on. How much time do we have?
We have like 3 minutes. That's okay. Can you get a pencil really quick?
Yeah.
Abrasions, contusions throughout body.
Grab another pencil.
Right rib fractures.
Okay.
For this one.
Fracture.
And then here write no suicide, no or I guess like cause for suicide, so that's why it's not suicide.
And then no previous.
Should we write for like why it's not accidental? Because there's too many injuries for it to be accidental.
Yeah. And they're also
like
very blunt force.
Blunt force, so not accidental.
And then accidental, not accidental because she was in the garbage truck.
Yeah.
No previous suicide.
I already wrote no homicide. Okay, we have a minute and a half. That's okay.
Okay. No. Wait, why is it not accidental? Why is it not accidental? Oh. Dumping of body in garbage truck. Not accidental. Okay, is there anything else?
I think that's it.
That's it? Okay.
That's it.
Okay.
Are we good?
Yeah.
Thank you.
Thank you.
We are stopping at 39 minutes and 17 seconds.